Good morning. My name is Dr. Stephen Reichbach, and I'd like to thank everybody for coming. I'm going to be talking a little bit today about a hot button topic here, not only in Florida, but at the national and federal level as well. Medical marijuana and medical cannabis. And just to give you a little background about myself, I'm a board certified anesthesiologist. I've been in practice since 1994. Moved down to west coast of Florida 3 years ago. Prior to that, I was practicing as an anesthesiologist in a large anesthesia group in New York, primarily in the operating rooms, surgery centers, endoscopy suites. And when I came down to Florida, I decided I wanted to do something a little bit different. Take my skills as an anesthesiologist and open up an office where I can offer patients who have been suffering with severe conditions and diseases that have gotten very little or no relief from conventional modalities of therapy. And from that, the Gulf Coast Ketamine Center was born. And what that was an infusion center, primarily giving IV infusions of ketamine to patients with certain mental health conditions, severe depression, anxiety, PTSD. And as time went on, and I started reading more about medical cannabis once it had been legalized here in Florida, we added the assessments for qualified patients in September of 2017 as one of our services. Just a little background about cannabis in general. It's actually been around for over 4,000 years. It's been used by every culture all over the world, every part of the world, as an anesthetic, as a pain reliever. It's been used in rituals and different medicinal purposes since that time. It was actually used in this country widely for medical purposes up until the 1940s. I don't know how many of you are familiar with the term reefer madness, but in the 1940s, there were a bunch of high-level politicians in this country who decided to make it their goal to make marijuana public enemy number one. And they got the word out that it was going to destroy culture as we knew it. It was going to destroy our youth and the future. And they were able to classify it as a Schedule I drug at that point. So what does that mean, a Schedule I drug? Well, that means that as far as the federal government was concerned, it had absolutely no medicinal value and was considered extremely highly addictive. Once it became a Schedule I drug, it basically put the kibosh on any kind of research that had been going on or that was going to be going on from that point on to determine what the benefits were from it, and the stigma that got attached to it remained for years and even continues to this point, as you all know. There was a patient who got special permission to use it in 1976 to treat an extreme case of glaucoma, but those were very few and far between. In January of 2016, Amendment 2 passed in Florida, which gave patients who had qualified conditions the right to use medical cannabis here in Florida. There is a TV doctor, Dr. Sanjay Gupta, who's become a very vocal advocate for medical cannabis, and he's appeared on a number of CNN specials. We were going to try and show a small excerpt of that here, but we couldn't get the sound to work. He was somebody as a physician who was very much against medical cannabis up until a year or two ago, when he started looking further into it and reading the actual research, mostly coming from Europe and Israel, and he's become 180 degrees on the other side, a very staunch supporter of medical cannabis, almost considering it a crime not to offer it to certain patients. In any case, we've got issues and obstacles to cannabis use. As I mentioned before, federally, cannabis is still considered a Schedule I drug despite many attempts to change its status to Schedule II. What does that mean? Well, you can't travel outside of the state that you have a card. So if you live in Florida and you have a medical cannabis card, you can't cross into Georgia with any products. Your card won't be any good. There's no reciprocity between states. You can't take it on a plane. You can't take it on a train. The only state that will recognize a marijuana card from a different state is Nevada. Another big issue, and one that a lot of our patients are concerned with, is the employment regulations. There's no protection for employees as far as employers firing you if they find out that you test positive for it, whether you have a card or not. There are ongoing lawsuits pertaining to that, but as of now, there are no protections to employees. A lot of our patients come and they've been to pain doctors and psychiatrists, and they've been on different medications, controlled medications, and their physicians will refuse to continue those medications if the patients decide they want to pursue a medical cannabis card. This becomes a real issue because many of these medications that they're taking can't be stopped abruptly. And they need to be weaned off, and they need to have their pain controlled, at least to the level that they are when they start to try to come down off those medications. So a lot of times patients are forced to make a choice as to whether they want to start medical cannabis or they want to not do medical cannabis and continue on the road that they've gotten to at that point, which hasn't been very rosy. Another problem, another issue, because it's considered a Schedule I drug, the federal government considers it illegal. It's not covered by insurance. Medicare and Medicaid, federally subsidized, aren't covering it at this point in time. Private insurance follows Medicare and Medicaid, as everybody knows. Again, due to its history, as I mentioned, it's still a taboo, very taboo. We have a lot of patients, a lot of elderly patients, who have thought about it and considered it and been told that there's a good chance it can help, but they just can't bring themselves to get a card. And it's marijuana. It's, how can I do that? That's illegal. It can be cost prohibitive to patients on fixed incomes. There's the assessment, there's the state fee, and then there's the cost of the products. So that becomes an obstacle to a good many patients. The medical community itself, internists, family practice docs, more and more those barriers are breaking down, but again, the tabooness of it, even as far as the medical community and promoting it and giving it a try, still a lot of work needs to be done with that. Those are the obstacles. What are the benefits of cannabis? Well, it can be extremely effective in treating a wide variety of conditions. And just to give you an example, patients with glaucoma, patients with chronic pain syndromes, anxiety, insomnia, PTSD. We had a patient an elderly gentleman who had increasing eye pressures, was suffering from glaucoma, was on all kinds of eye drops, had been for years. The doctor was suggesting surgery, laser to help him with that. He went to Colorado to visit his son and spent about 2 weeks there. And when he came back, his son, by the way, was a pot smoker. I guess that's sort of inferred, but so he was around the secondhand smoke while he was there. Comes back, gets his eye pressures checked, and finds out that they're significantly decreased. So his ophthalmologist says, well, what did you do different? Couldn't figure it out. Left the office, said, the only thing I did different was go to visit my son. Maybe there's something to it. Goes back to his doctor and said, I'd like to try medical cannabis. Doctor says, if you want to do medical cannabis, you need to find another ophthalmologist. I don't think that it's a good thing to do. Comes to our office, explains the situation, says, can we do this without telling my ophthalmologist? I said, there's no downside to you doing it. You know, what's between you and your ophthalmologist? If he tests you and sees that you've been using it, then you may have a problem. You may need to find another ophthalmologist. In the meantime, flash forward, he got his medical cannabis card, has been using the product regularly. His eye pressures continue to be stable, continuing on the same regimen, and his ophthalmologist is scratching his head and saying, just, you know, must be the eye drops. Okay. In any case, it's a natural alternative to many pharmaceutical medications. A lot of people would prefer to go more natural these days instead of buying into all the pharmaceutical, you know, the way the pharmaceuticals are going. It works with the body's own endocannabinoid system. Many of you probably don't know that the endocannabinoid system is the largest endocrine system in the body. There are endocannabinoid receptors in just about every organ, every tissue, every cell, from your brain to your spinal cord to your immune system, digestive system. And when there's an imbalance between the amount of substrate that binds to those receptors and the receptors themselves, that's what causes flare-ups of many of these conditions. And the cannabis is thought to put it back into equilibrium and thus quell a lot of the symptoms that patients suffer from at that point. Less overall side effects than most of the pharmaceutical medications, less addictive qualities. There are also, what many patients don't understand, a lot of different routes of administration. You don't just have to smoke or vape and inhalation. There are oral routes, there are capsules, oral tinctures that you put under your tongue. There are creams, there are suppositories for anybody who prefers that. There are nasal sprays. So there's many different options as far as that goes. It can be used daytime and nighttime in different forms to treat different conditions and maintain alertness. It allows for most importantly to me, it allows for the possibility of decreasing use of more harmful and addictive medications. It's shown a very high success rate in treating insomnia. Everybody's got insomnia, and it makes everything worse. It helps with that, and chronic pain. Believe it or not, the average age of our patients is 60 years old, and I found that very, very enlightening and very eye-opening when we first started doing this. Next question would be, who qualifies for a medical cannabis card? Well, here in Florida, there are certain conditions that qualify patients for it. Cancer, any kind of cancer, Crohn's disease, glaucoma, HIV/AIDS, multiple sclerosis, epilepsy, PTSD, and ALS, also known as Lou Gehrig's disease, Parkinson's disease, chronic non-malignant pain arising from one of the above conditions, any terminal condition with a less than 1 year survival rate. And here's the caveat. Any condition of similar type or class of conditions mentioned above. So that basically gives the ability to the qualifying physician to use his discretion to determine whether a patient would qualify. So anxiety may not be on that list, but a large number of our patients have anxiety, and anxiety symptoms can be very similar to PTSD. So many of those patients would qualify. Insomnia. Many patients come in and their only complaint is insomnia, and they've been on every sleep remedy. Nothing works, so they keep taking more and more. Become addicted to it. They want to try something natural. Some of those other conditions that aren't mentioned, arthritic pain, post-surgical pain, OCD, back pain, migraines, fibromyalgia. There are studies now going on with CBD treating children with autism, and the immediate response, the studies that are coming back, at the preliminary level are very encouraging. Autoimmune diseases, neuropathies, Alzheimer's disease. The card application. What are the rules and regulations to get a card here in Florida? Well, you've got to be a state resident or reside in the state for more than 31 consecutive days. You need proof of residency, including a driver's license, utility bill, water, gas, electric within the last 60 days. The state will take your picture of your driver's license if you have a driver's license here in New York State. The fee is $75 that the state requires as a processing fee. And you must have a qualifying physician, such as myself, to do an initial evaluation. And you must have medical records from another physician that's taking care of you for the condition that you're applying for the card for. So we would need records from the last 6 months, just documenting that you've had this chronic condition. Once a patient's been deemed qualified to obtain a medical cannabis card, the recommendation is placed by the qualifying physician into the state database. Patients are then directed to a dispensary to purchase their cannabis products. There are 14 different dispensaries throughout the state, and I'm very pleased to work closely with one of the largest dispensaries, Sarasota, and have a representative from them here today with me, Christina Rispoli, and she'll give you a little talk from the dispensary side, and we'll answer any questions after that you guys might have.
Hey, good morning, everyone. My name's Christina. I work for Sarasota Wellness. I'm going to be super brief because I think Dr. Reichbach did a really good job at covering the basics. Sarasota was one of the original 5 license holders in the state of Florida to grow and dispense cannabis. We've taken a little bit of a different strategy than a lot of the other dispensaries in the state. We really provide the most consistent and standardized medical cannabis. We've tried to take out the fluctuation, and we've really designed effect-driven products. We have several different routes of administration set up in the back. That way, if anybody wants to look, a lot of people picture like people smoking bombs and things like that, but that's actually not legal in the state. It's mostly tincture oil. We have a transdermal patch. There are capsules. There's really a ton of different routes depending on that patient's goal of treatment. Another thing that I think a lot of people don't realize is there are different cannabinoids that can provide relief to people, not just THC. The THC is the one that most people are familiar with, that provides that psychoactivity that helps with pain, but that's only kind of one piece of the puzzle. There's a lot of other components to medical cannabis that can provide relief for a lot of people that haven't found success with more traditional medicines and pharmaceuticals and things like that. So as with any medication, this is not really for everyone, but we ask that, it's in the running. For some patients, they've found more success with the medical cannabis than they have with others. So I think we should probably open it up for questions, if you're okay with that. Does anyone have any questions for us?
No, okay. Not at all.
I understand that the conditions that are allowable are dealing with the different endocannabinoid systems. How do you, as the prescription writer, the doctor that's trying to keep abreast of all of the changes, the authorization, all of the different strains that are coming out, how do you manage to write that prescription so specifically for one condition and determine its effectiveness, and then possibly try something else? I mean, that the information base is growing so fast. How do you keep up?
The first thing you have to determine is what the patient's tolerance is as far as the psychomimetic effect that they may feel while they're undergoing treatment. And some patients don't want to have any psychomimetic effect. So you sort of rule out the high THC products from them, at least at the beginning, and you start with the CBD, which can have some good medicinal value, but not give you those psychomimetic effects. Now, with everybody, what we're finding is that regardless of age, comorbidity, everybody seems to respond differently to this as far as dosing and as far as different products, and products that may help one condition in one person may have no effect on somebody else. So probably the most frustrating part of this is trying to convince patients that there's a trial and error period when they first start, and they're going to have to try a bunch of different things, different routes of administration, starting at very low doses and slowly increasing them until they find the balance between the response they want to help with their condition and a tolerance from the psychomimetic effects if you're introducing the high THC products. So I think that's the way we try to approach it. It's start with the low doses, slowly increase as tolerated until you get the response. And you just keep trying different products. What one route of administration to treat somebody's anxiety may not work in another patient. So they may need to try a different route of administration. They may need to try a different product. So there's a lot of trial and error, but once they find their sweet spot as far as product and timing of the dosing, it generally works out very well for them. Sure.
I have two questions. First, I want to preface what I'm about to ask. I'm a big believer. I have friends who, various forms of cancer, who use the liquid format. I have a brother with MS who, if it wasn't for it, he probably, quite honestly, wouldn't be alive and have the mobility that he has today. Two questions. What I don't understand and what I've been confused about, maybe you could shed light, is why wouldn't like neurologists, oncologists, why wouldn't they be partnering with you and prescribing those things? Because they have, I mean, there's very proven data out there that these things do work. And I mean, I know the pharmaceuticals, but you can't blame everything on pharmaceuticals. Doctors write scripts for a lot of things. So that's my first question. And then secondly, how are we regulating it as a state? Because I lived in California, and I can assure you, every single person in the state of California knew how to manipulate. Oh, I'm not sleeping well, I need to get me something. Or, oh, I've got anxiety, I need me something. You could not walk down a lot of public streets without people, and they got the smoke form, you know. And that was like, I'm all about it if you need it medically, but at some point, you know, that's offensive to me and my children. So what are your thoughts on those two things?
The first thing to answer your first question, there are quite a number of neurologists, oncologists in the private sector who do believe in this, and we do get referrals from them, and some of them, in fact, have taken the course and are prescribing it for their own patients. The obstacle for them comes in when a lot of these private docs join these big health groups, and it becomes, it's more of a company policy that they're not getting involved with this just because it's federally illegal. And so they themselves cannot, as part of these big corporate entities, get involved directly with it. So they have to turf those patients out to, you know, private docs that have done it and are doing it. There's no perfect answer to your second question. There's no perfect answer as to how patients get qualified or how it's regulated. There are requirements that you need to get the card. You need to show proof. You need to bring documentation from a physician that's been taking care of you for, you know, the last 6 months to a year, and documenting what other treatments you've been through, how long you've had this diagnosis. You do a history and physical when the patient comes for the assessment, and you make the determination. Those are the rules. That's how it's run. I guess there's no perfect system, and there's patients probably who slip through that shouldn't. But all in all, I think for the greater good, it's giving access to patients who really need it, and it's probably a small price to pay if a couple of people who shouldn't get it, you know, get their hands on it. Yeah.
Just to add something quickly, on that note, that's why I see a lot of physicians that do cannabis recommendations in the whole southwest coast of Florida. And I think that exact reason is why it's so important for physicians that maybe aren't necessarily doing cannabis recommendations to have a physician that they trust, that they know that they can refer their patients to instead of just, I don't know, it's out there, good luck. Because there are some scammy things out there, and in my opinion, it illegitimizes the whole industry. And so that's why at Sortero, we choose to partner with people, that are doing this really well and doing this for patients that need it. So I wanted to give them a shout out for that.
Thanks. Sure.
So as far as healthcare facilities and patients using medical cannabis in skilled nursing facilities, assisted living facilities, those type of settings, what are the rules and regulations on that as far
Can you
as?
repeat the question, please?
As far,
Yeah.
She asked what the rules and regulations are as far as healthcare facilities, assisted living facilities, I guess nursing homes. I'm not 100% sure. What I think it's basically these private facilities. They can decide how they want to approach it. We've had a number of patients who have come to us from assisted living facilities, and they were told that it won't be dispensed to them by the facility if they want to keep it in their room and do with it as they please. I've been asked to write letters, so that patients can use it as documentation that it's being used for medicinal purposes, so they have that around if there are ever any questions. But I believe it's up to the facility itself, whatever their policy is as far as that goes.
What do you buy? I actually purchased CBD oil over the counter at a regular store, and I'm curious what the difference between what you prescribe and what you can get there, and the difference in price.
Okay, so CBD is legal, I think, basically in every country, and in every state in the country. What you're purchasing is from the hemp plant, industrialized hemp, and the CBD is gotten from there. It's not quality controlled. It's not quality tested. There's no guidelines or oversight from the state of Florida or anywhere else. They actually did some random testing of sampling from a couple of different websites and by the side of the road type places, and purchased it and tested it. And a good number of them had the predominance of the ingredient was olive oil. They had additives that you probably don't want to necessarily put into your body. So you need to be careful if you're purchasing CBD in that manner. And I'm sure there's a number of reputable places that you could purchase it from, where it will probably help you with whatever conditions you're looking to treat. But I think you need to be careful as far as going down that route. The advantage to getting a medical cannabis card here in Florida and purchasing it from a dispensary is that it's quality controlled, it's tested, the oversight is there, you know what you're getting, and it comes from the cannabis plant, and which is different than the hemp plant. And if I was making the choice for myself, I would probably go that route if I wanted to use CBD. Plus, it would give me the option to use the higher THC products if I needed to. All the way in the back.
Does purchasing medical marijuana with a prescription result in entering that information into any federal database such as the Medical Information Bureau?
I do not believe that's so, no.
I have a friend who has fibromyalgia.
Mhm.
She's been disabled for many years because of the pain. Is that a condition that they would use for?
She would obviously need to be evaluated, but we have qualified a number of patients with fibromyalgia. Yeah.
And do you know information about other states? Like I was thinking about my mother has dementia and she's in Minnesota. Would you have recommendations of Are there other states, where you could recommend places?
How many other states?
Cannabis is legal at least in some form, I believe, in at least 29 states, but because they're all state programs, they're gonna be different in every state. So you would have to kind of do a little bit of research there in Minnesota, and maybe we can help you do that afterwards just to see. But I am not familiar with Minnesota, but being that it is like an individual state program, it would be different. So I might take a little bit of research, I'm not sure, sorry.
Thank you.
Again, regarding the tailoring of a prescription for someone with one condition versus another. And not just changing the THC content in a prescription, but do you have in your formulary specific formulas that are for MS or for Crohn's disease, and are they different?
In general, certain conditions are known to be more responsive to high THC. Some conditions are better responsive to CBD. As the recommending physician, I don't write the prescription as far as specific strains. What I write is either high THC, low THC, and give the patients the option to purchase either or some combination of the two. And once they get to the dispensary, they have a better feel for their types of products and the strains that may be more directed to what they're trying to get a response to. So there are better resources as far as fine tuning and more strain specific type attacking of it. Yeah.
Have you seen any positive benefits for patients with mild cognitive impairment or dementia?
We haven't had a whole lot of patients that have come in specifically for dementia. There are patients who have come in with other conditions and have been diagnosed with Alzheimer's as well. And just anecdotally, when they come up for follow-ups, they will say, or the family members will say, I've noticed there is some improvement with their memory, or we haven't really changed anything else. So, can we attribute it to that? And I say, I guess we can. I mean, we'll keep track of it. It's something to keep an eye on, but there are studies going on as far as helping to treat with Alzheimer's, and it's a potent anti-inflammatory. So that's one of the mechanisms that it's so helpful with a lot of these chronic conditions.
Okay, we're getting pressed for time, so one more. If you have questions after we take this one, you're willing to stay after the meeting, yeah, there you go. So. Okay.
I thought it was one
Yeah.
more.
Yeah.
One more.
Thank you. I have some friends that are buying the CBD over the counter.
Mm-hmm.
They swear it cures everything.
It does.
So my question is, for those of us who are, work for corporations that like to do random drug testing, is there THC in it?
To answer your question, yes, it's extremely, extremely low levels of THC. So if you were to get tested, it wouldn't show up for THC.
And then I just wanted to make a comment to somebody who was asking about why some places don't allow it. Like for Tidewell Hospice, we have to wait until it's medically okay by the federal government. So even though we're a hospice just in Florida, we can't dispense it, we can't order it. And then the third question, sorry, 60 Minutes, I watched a show, and they're going down and showing the different types of cannabis that worked on different things, and it seemed like it was more, the word I'm looking for, more directive for whatever the health issue is than just the amount that you're playing with, so I'm just curious.
I think that's the direction that we're going, and obviously that's the way to attack this. And I know the studies going on in Europe and Israel that are doing just that. They're finding the specific components of the cannabis plant. Instead of throwing a blanket over a lot of conditions with one particular product, they're finding components of it that specifically attack certain conditions and certain diseases so that it can be more precise and more directed like that. I think that's coming. That's the next step.
Thank you.
Dr. Reichbach, thank you so much.
Thank you so much.